So in this part, we are going to discuss the next drug, that is the garlic. This is one of the nutraceutical. There are so many nutraceutical products are available in the market for the garlic. We are using the garlic as spices, and it comprises the major chemical constituents, that is the allicin. So let us move towards the garlic. So garlic is an herb related to onion, leeks, and chives. It is commonly used for conditions related to heart and blood system. So whatever the garlic related products are there, it is being used for the treatment of certain heart and blood diseases, heart and blood system, that is cardiovascular diseases. Mainly the garlic products are being used. So the garlic, it is the fresh compound bulb of the Allium sativum, belongs to family Liliaceae, right? So biological source of garlic, it is a fresh compound bulb of Allium sativum belonging to family Liliaceae, right? The synonyms for garlic, that is a Lasun or Lasun. So see the image which I have placed on the slide so that you will understood what is the Lasun or the garlic. So in the case of garlic, we are using the fresh compound bulb of the Allium sativum belonging to family Liliaceae, and mainly it is used for the treatment of certain cardiovascular diseases. Let us move towards the chemical constituents of the garlic. Mainly the garlic comprises the sulfur compound. If you can see, the majorly it comprises the minerals, vitamins, carbohydrates, amino acids, volatile oils, other trace elements, sulfur compounds, allicin, diallyl disulfide, allyl propyl disulfide, selenium, and scordinine. These are the major chemical constituents of the garlic. Whatever the pungent smell of the garlic, it is due to the organosulfur compounds which are present in the Allium sativum or garlic. The main sulfur compound present in the garlic, it is a glutamyl cysteine. It is hydrolyzed to form the allicin. When crushed allicin reacts with the enzyme allinase, it is going to form the allicin. So whatever the strong pungent smell of a garlic, it is due to the organosulfur compounds which are present in the garlic. The main sulfur containing compound is a glutamyl cysteine. It is hydrolyzed to form the allene. When the garlic is crushed, listen carefully, when the garlic is crushed, the allene reacts with the enzyme allinase and it is going to form a allicin. So the main sulfur containing compound present is the glutamyl cysteine, right, which is present in the garlic. It is hydrolyzed to form the allene. When we are crushing the garlic, the allene reacts with the allinase and it is going to form the allicin, right? So allicin, it is a chemically, it is a diallyl thiosulfinate, a yellow liquid responsible for the odor of garlic. Then the allene, it is another active principle which is present in the garlic. The other constituents which are present in the garlic are volatile oil, fatty oils, mucilage, and albumin. So these are the certain other chemical constituents which are present in the garlic, like volatile oil, fatty oil, then mucilage, and albumin. If you can see the percentage wise, the garlic comprises around 28% of carbohydrates, 2.3% of organosulfur compounds, and 1.2% of free amino acids. The essential oil approximately 0.06 to 0.1% present, which contains the allyl propyl disulfide and diallyl disulfide. The amino acids which are present in the garlic bulbs are leucine, methionine, S-butylcysteine, and sulfoxide. Furthermore, the garlic comprises the geranium, magnesium, zinc, vitamin A, C, and the volatile oils. So these are the some of the chemical constituents of the garlic. If you can see, it furthermore it comprises the magnesium, zinc, vitamin A and C, and the volatile. So these are the chemical constituents of the garlic. Mainly, if you can see, it comprises the organosulfur compounds. That is allicin, allicin, right? Isn't it? So these are the major chemical constituents which are present in the garlic. Let us move towards the health benefits of the garlic. So whatever the health benefits of garlics are there, it is due to the presence of the some of the major chemical constituent in the garlic, that is allicin, allicin, and so on. If you can see, the garlic, it is being used for high blood pressure, high levels of cholesterol, and other fats in the blood, and hardening of the arteries. So garlic, it is responsible to manage the high blood pressure. So it is going to reduce the blood pressure. It is going to manage the levels of the cholesterol in the body. It is going to manage the fat levels in the blood, and furthermore, it is going to harden the arteries. So it has the great role in the management of the sudden cardiovascular diseases. Furthermore, the garlic, it is being used for the common cold and osteoarthritis. If you can see, the garlic oil, it is going to prevent the ear infection, isn't it? Some of the ear infections are going to be prevented with the help of the garlic oil. It is having the properties like antibacterial, then antifungal, and antiviral. So it could be helpful to prevent the sudden infections, as they are going to act as an antibacterial, antifungal, and antiviral. Apart from this, it is being used in the endometriosis, then atherosclerosis, then diabetes, then hyperlipidemia, hypertension, non-alcoholic fatty liver diseases, periodontitis, then stomach cancer, and digestive tract infection. These are the some of the disorders or diseases in which we are using the garlic. Let us see the further health benefits of the garlic. So apart from the previous thing, if you can see, the garlic, it is a low in calories and rich in vitamin C, vitamin B6, and the manganese. So it could be the rich source of vitamin C, vitamin B6, and the manganese. So garlic supplements helps to prevent and reduce the severity of common illness like a flu and the common cold. As you know that the garlic, it is having the properties like antibacterial, antifungal, and the antiviral. So it could be helpful to manage the flu and the common cold. Then high doses of garlic appear to reduce the blood pressure for those with a known high blood pressure, that is hypertension. In the case of hypertension, it is possible to reduce the blood pressure with the help of garlic. Then garlic supplement seems to reduce the total and the low density lipoproteins, cholesterol, particularly in those who have the high cholesterol. So garlic, it is having the ability to reduce the levels of the bad cholesterol. Then garlic may help to improve the blood flow, which could help to prevent the erectile dysfunction. So garlic, it is having the ability to promote the blood flow, and furthermore, that could be helpful to manage the erectile dysfunction. Then garlic may improve the physical performance in the people with the heart diseases. If we are consuming the garlic and say, for example, we have the heart diseases, it becomes very difficult to do the certain physical things. If we are consuming the garlic, definitely the physical performance, it is going to be increased by consuming the garlic. Furthermore, the garlic may significantly reduce the lead toxicity, right? Garlic appears to have some benefits for the bone health, as it is going to be used in osteoarthritis by increasing the estrogen levels in the females. Then garlic and its components could improve the male fertility, enhance the testosterone levels, and increase the sperm production. So garlic could be helpful to improve the male fertility, enhance the testosterone levels, and increase the sperm production. Garlic is a good source of antioxidants, so it is going to reduce the oxidative stress, and which could be helpful to improve the sexual health and the fertility. As the garlic contains the antioxidants that protects against the cell damage and the aging, and it may reduce the risk of Alzheimer's diseases and dementia. So these are the certain health benefits of the garlic. Let us move towards the dosage of the garlic. So the dosage, that is a whole garlic clove, 2 to 4 grams per day, fresh, and dried garlic, 600 to 900 milligrams daily. So these are the dosage which are recommended. So if we are taking a whole garlic clove, it should be 2 to 4 grams per day, fresh, and if the dried garlic is there, it is a 600 to 900 milligrams daily. Let us see the side effect. Okay, now we are aware about the health benefits of the garlic, but still it is having the certain side effects, and major side effects are stomach upset, then heartburn, gas and diarrhea, then bad breath and the body odor, loss of appetite, allergic reactions, then skin reactions and the bleeding disorder. Mainly the bleeding disorders are major ones. So these are some of the side effects of the garlic. Let us see the precautions and warnings. So in certain cases, there is a increase in the risk of bleeding, isn't it? Then garlic might prolong the bleeding, interfere with the blood pressure, and lower the blood sugar level. So stop taking a garlic at least 2 weeks before the scheduled surgery. If we have the scheduled surgery, as garlic, it is having a property to reduce the sugar level, it is having a property to reduce the blood pressure, and also it is going to increase the bleeding. So one should stop taking the garlic before scheduled surgery. So these are the warnings for the garlic. Let us move towards the drug interactions. Very first drug interaction, it is related with the garlic and warfarin. As you know that the garlic might increase the effect of warfarin. That is garlic, it is going to thin the blood. Warfarin also it is going to thin the blood. So by taking a garlic with a warfarin, that may lead to the chances of bleeding and bruising. So this is the first drug interaction that is related with the garlic and anticoagulant drug warfarin. Then the second drug interaction, which is related with the garlic and diabetes. So garlic, it is having a ability to reduce the blood sugar level. So taking a garlic with the anti-diabetic drug leads to decrease in the blood sugar level, that may lead to furthermore hypoglycemia, and one should monitor the blood sugar level when the garlic it is combined with the anti-diabetic medication. So this is the second drug interaction. Then the third drug interaction with the garlic, that is the garlic and antihypertensive. So garlic, you know that it is going to reduce the blood pressure. Antihypertensives, they are also going to manage the blood pressure. Garlic, it is going to reduce the blood pressure. Antihypertensive, also they are going to reduce the blood pressure, isn't it? So when we are combining the garlic with the antihypertensive, that may lead to the chances of hypotension, reduction in the blood pressure, right? And one should monitor the blood pressure if the garlic and antihypertensive drugs are combined. Then furthermore, it is going to potentiate the action of anti-hyperlipidemic drug. As garlic, it is going to reduce the cholesterol level. So it is going to potentiate the action of the anti-hyperlipidemic drug. The next drug interaction, it is related with the garlic and isoniazide. So this is the drug interaction related with the reduction in the absorption of a drug. So garlic might reduce the absorption of the isoniazide from the stomach. So there might be chances of reduction in the effects of isoniazide. Isoniazide, it is a drug, it is being used as a anti-tubercular, isn't it? In the patients with the tuberculosis. And if we are consuming the garlic along with these medications like isoniazide, there is a reduction in the blood levels for the isoniazide due to decrease the absorption, right? And the effects of isoniazide, it is going to be reduced. Then the next drug interaction, which is related with the garlic and atazanavir. Atazanavir, it is a antiviral drug, right? And garlic reduces its absorption. So the effects of the atazanavir, it is going to be reduced when we are combining the garlic with the atazanavir. So atazanavir, it is antiviral, right? When we are combining the garlic, the absorption of the atazanavir, it is going to be reduced, and furthermore, the effects of atazanavir, it is going to be reduced. The next drug interaction, that is taking garlic, might decrease the amount of HIV or AIDS medication the body can absorb. If you can see, there are so many drugs are there which are being used to manage the HIV or AIDS, and the absorption of all these drugs are going to be affected by the garlic. That is, absorption of these drugs are going to be reduced. So furthermore, the effects of the anti-HIV drug, it is going to be reduced. The next drug interaction, it is related with the tacrolimus, that is the garlic and tacrolimus. So garlic might decrease how quickly the liver breaks down the tacrolimus. So by taking garlic with the tacrolimus might increase the effects and side effects of the tacrolimus. So this is a drug interaction related with the enzyme inhibition. Garlic might inhibit the certain enzymes which are responsible for metabolism of the tacrolimus, and that could increase the serum levels of the tacrolimus, and furthermore, its effects and side effects are going to be increased. Then the next things which are related with the CYP2E1 and CYP3A4 substrates. So CYP2E1 substrates interact with the garlic. So garlic might decrease how quickly the liver break down the drug metabolized by the CYP2E2. So this could increase the effects and side effects of these medications. And the next one, that is CYP3A4 substrates interact with the garlic, and garlic might decrease how quickly the liver break down the drugs metabolized by the CYP3A4. So this could increase the effects and side effects of these medications. There are certain medications are there which are being metabolized with the substrates CYP2E1 and CYP3A4. So garlic, it is going to interact with the CYP2E1 and CYP3A4, and the levels of the drugs which are being metabolized by the CYP2E1 and CYP3A4 going to be increased, and that may lead to the increase in the effects of these drugs as well as the side effects. So these are the few major drug interactions related with the garlic. So in this part, we have discussed the biological source of garlic, synonym of garlic, chemical constituent of garlic, then health benefits of garlic. Then we have discussed the dosage, side effects, and the precautions and the drug interaction.